Hello, my name is Alexis Delaughter, and today I will be presenting my capstone project titled Enhancing Patient Experience and Compliance Through the Dental Assistant's Role in Anxiety Management. This project explores the root causes of dental anxiety, what role the dental assistant can play when working with patients who experience dental anxiety, and what type of training would need to be involved in preparing dental assistants for this important responsibility. Experiencing anxiety or fear prior to a dental appointment is a frequent and well-documented experience. In fact, studies estimate that a majority of dental patients suffer from fear of the dentist, and some even avoid going to the dentist altogether due to anxiety. Dental anxiety can be defined as the fear of going to see a dentist or the fear of obtaining dental treatment. It can be caused by previous traumatic experiences, the feeling of loss of control while in the dental chair, distrust, or even fear of the unknown. Dental anxiety can also sometimes border on dental phobia, which can prevent patients from wanting to seek oral health care altogether and begin to affect their overall health. Avoiding the dentist can ultimately lead to decay, teeth needing to be extracted, and periodontal disease. Systemic body conditions such as heart disease, diabetes, and even cancer have also been linked to poor oral health, which raises a cause for concern. While dental anxiety remains a significant issue for many patients, dental assistants are uniquely positioned to help promote change when properly trained in patient management. As vital team members who spend more time with patients during restorative treatment than the dentist, dental assistants can effectively build relationships with their patients by properly communicating, providing empathy, and using other skills to help patients manage their anxiety and encourage long-term treatment compliance that benefits both oral health and systemic health. Dental anxiety is a widespread issue that affects various types of people. Factors such as age, gender, and education levels play an important role in affecting dental anxiety in people. While there are many strategies that dental offices use to try to combat dental anxiety, most patients expect the dentist to be the one who calms them down, especially during restorative treatment. Dental assistants often get overlooked by patients, even though they are typically in the best position to help manage patient anxiety, since they spend the most time with the patient during restorative appointments. Patients often fail to realize the training and experience that dental assistants typically have, which puts them in a unique position to build better patient relationships than the dentist. Historically, dental anxiety has been a common issue that can be traced all the way back to the late 1800s. Since the average patient load has also increased drastically over the last 20 years, dentists are not as capable of spending time reassuring anxious patients anymore, which is where the dental assistants can easily fill that gap. It is estimated that 60% of dental patients suffer from fear of the dentist, and as many as 20% avoid going to the dentist altogether due to their anxiety. The effects of the problem are severe, since high levels of dental anxiety are often associated with poor dental care utilization that then affects oral health outcomes as well as overall systemic health. From a patient's perspective, patient anxiety can be a long-standing issue that stems from fear of the unknown, fear of instruments or procedures, the perception of loss of control, previous negative experiences, or exposure to fear-inducing media. Increased anxiety can also be correlated to increased pain being reported by patients during treatment. A 2006 study examined the link between dental anxiety and the impact it can have on oral health, since many patients who suffer from dental anxiety will avoid receiving dental treatment. Research also has suggested that dental assistants are best positioned to help patients with their anxiety. A 2025 study examined the pivotal role of dental assistants in easing the fear of patients with dental anxiety, while enhancing their overall comfort during dental visits. Since dental assistants are in close contact with patients during restorative treatment, they are truly in a unique position to help reduce patient anxiety, since they typically receive specialized training in communication and techniques that are designed to make the patient's experience more positive. These techniques can include minimizing patient wait time and setting expectations with the patient about what they can expect during the dental appointment. According to Al Schwab's study, the importance of patients feeling comfortable during a dental appointment is well documented. A relaxed patient is more cooperative, enabling the dentist and other members of the dental team to perform their duties efficiently. Patient education is also critical for preventing dental issues from arising. The 2025 study also found that by educating patients on the importance of preventative dentistry, the dental assistant contributes towards patients experiencing fewer cavities and periodontal problems. Research of dental anxiety indicates that it is a common occurrence in a majority of the population that can lead to neglect of oral health. Disagreements in the research of dental anxiety typically revolve around whether psychotherapeutic, pharmacological, or a combination of both methods are best at managing patient anxiety. Psychotherapeutic interventions typically aim to change behavior by learning or cognitively, which aims to alter and restructure the patient's control over negative thoughts. Examples of psychotherapeutic interventions include communicating and building trust with the patient, deep breathing exercises, guided imagery, hypnotherapy, distraction, and positive reinforcement. Pharmacological interventions include the use of sedation and general anesthesia to control levels of pain and anxiety. Some argue that pharmacological methods should only be used in situations where the patient is not able to respond and cooperate well with psychotherapeutic interventions, while others may use pharmacological interventions as a first choice. Studies have shown that psychotherapeutic interventions maintain reduced anxiety over longer periods of time, while pharmacological approaches are less accepted by patients and have shown to be effective for short periods of time. Past negative experiences can cause negative conditioning in patients. Just one negative experience as a child can cause lifelong suffering for patients that can only get worse if poor oral health persists. Even just hearing about a friend or family member's bad experiences can cause anxiety in some patients. Unpleasant stimuli, such as the noises of the dental handpiece or unpleasant smells, are often main culprits of causing anxiety. While early research seemed to be more focused on pain management, developing anesthesia to reduce pain levels, new research recognizes the psychotherapeutic interventions available, such as communication and building trust, to help manage dental anxiety. There is also increasing recognition that dental assistants are in the best position to build the strongest relationships with patients since they spend the most time with them during these restorative appointments. While there are various methods of reducing dental anxiety, dental assistants are often underutilized in the intervention process, even though they are able to provide the essential aspect of human connection that can help patients feel more comforted and relaxed during treatment. This could be related to the level of training, or lack thereof, that dental assistants currently experience. Many states across the country, including Pennsylvania, do not require dental assistants to have formal education before working on patients. This is deeply concerning since it is then up to the dentist to personally train dental assistants on how to perform all clinical duties and effectively manage patient anxiety. While sedation and general anesthesia is an option for patients facing dental anxiety, there are some risks associated with being put to sleep for treatment. A medical risk assessment should be conducted prior to having an anxious patient put to sleep for treatment to ensure that the patient does not have pre-existing conditions or allergies that the anesthesia could affect. Human error can also occur if there is poor communication or distraction among personnel. Equipment failure is yet another possible cause of concern. Medications that alter memory, such as triazolam, have also become popular for patients with dental anxiety. Triazolam is an oral benzodiazepine that has a rapid uptake and minimal side effects, but also has been shown to reduce the stress of dental treatment for many patients. While research suggests that triazolam can help reduce how patients recall discomfort during dental procedures, it does not help to teach patients new ways of coping with their dental anxiety. Instead, they are just masking their fears with pharmacological medications. Increased training in communication and patient management techniques should be provided to dental assistants so that they are able to help patients manage their anxiety more effectively while at the dentist. Since dental assistants already have increased contact with patients during the restorative treatment, they should be equipped with the proper skills to lead the effort of enhancing the patient experience while reducing fears. By providing targeted training in psychotherapeutic interventions, such as positive communication, deep breathing exercises, guided imagery, hypnotherapy, distraction techniques, and positive reinforcement, dental assistants can become trusted healthcare providers who patients can look up to for guidance and education. This solution works because dental assistants already possess many of the skills needed to manage patient anxiety, especially if they have already received official dental assistant schooling. Since many states in the U.S. do not require dental assistants to complete schooling, and dentists often train assistants off the street, there is an overall lack of patient management skills that can be improved upon. Empowering dental assistants to use these skills and interventions can help reduce patient anxiety, improve patient compliance, and therefore could lead to better overall systemic health. Individual state dental boards would need to mandate proper education for all dental assistants. Another option would be for the Dental Assisting National Board, also known as DANB, to set national education standards in place. DANB recently released a dental assisting professional model, which proposes frameworks that states can adopt to ensure sufficient training for qualified dental assistants. About 8 in 10 dentists and dental assistants also report supporting national regulations so that there is greater uniformity in dental assistant education. Current dental assistant education programs can integrate dental anxiety management courses into their current curriculum to ensure that their students are receiving the necessary training. For dental offices, continuing education training can be provided yearly to keep dental assistants up to date with the latest patient management interventions. The primary cost of implementing this specialized training for dental assistants could be relatively affordable if it is incorporated into existing college and technical school dental assistant programs. Student loans and federal grants can be used to offset the cost of tuition. Scholarships that are funded through dental insurance companies, dental offices, and other donors can be offered to students who may not have the funding available to attend school. For dental offices, costs of implementing patient management training would be low. Offices are already required to conduct yearly training for OSHA and HIPAA, so patient management exercises can easily be incorporated into that schedule. Role-playing exercises focused on communication skills and anxiety reduction techniques would cost little to nothing. Purchasing low-cost items such as stress balls, speakers to play calming music, or aromatherapy tools would provide patients with sensory comfort during restorative treatment. Together, these low-cost strategies could significantly reduce dental anxiety while enhancing the patient's overall experience. The ideal outcome of the proposed solution is that dental assistants will all be properly trained to manage patient dental anxiety, which will help to encourage continued dental care and promote oral health and overall body health. This solution includes the implementation of national educational standards to ensure that patients receive the same level of anxiety management across the country. Unintended consequences could include dental assistants requesting higher pay if they are required to receive a college or technical school education. According to a recent study by the Dale Foundation and the Dental Assisting National Board, salary is a top job factor for dental assistants. Insufficient pay is the top reason for dental assistants' dissatisfaction at work and the #1 reason dental assistants leave the profession. Increasing pay can increase retention while offsetting the cost of turnover, resulting in increased productivity and higher revenues. The study also revealed that 94% of dental leaders believe that dental assistants help improve patient retention and that dental assistants make a meaningful impact on dental practice productivity. While the dental offices will benefit from the outcomes of this program because of patient retention, the ones who will benefit the most are the patients themselves. Patients will be able to experience dental visits with reduced levels of anxiety and increased trust, which can lead to more consistent compliance for future care. This can improve the patient's oral health outcomes and ultimately their entire body health. Finally, dental assistants will also benefit from this program because they can gain increased job satisfaction from helping patients overcome their fears and prioritizing their oral health. There are multiple stakeholders to consider in this proposed solution. First, dentists ultimately oversee patient care in the dental office. They regularly have to work with anxious patients, which can extend treatment time during procedures and leave them financially affected if patients avoid coming back to the office for continued treatment due to anxiety. The dental assistants are also major stakeholders because they will be the ones spending the majority of the time with patients during restorative procedures and using their skills to help reduce patient anxiety. Having increased training can make them more confident in their skills that can then lead them to increased job satisfaction. The patients would perhaps benefit the most as stakeholders. Since so many patients are affected by dental anxiety, which can ultimately cause them to avoid going to the dentist, having properly educated dental assistants who are trained in patient management is extremely beneficial to them. By identifying the signs of anxiety before treatment begins, the dental assistants can help ease their fears at the beginning of the appointment to allow for a relaxing, enhanced experience. Once trust is built between the patient and dental assistant, the patient will be less likely to avoid coming to the dentist. This will allow the patient to have more preventative treatment and improve their overall oral health. Since there is a direct link between oral health and overall health, having improved oral health will also benefit the patient's systemic health. Finally, the state and national boards would also be considered stakeholders. Since there currently are not any national guidelines for dental assistant education, the State Board of Dentistry in each state would be required to set guidelines for educational requirements. Ideally, dental assistant education requirements will someday become nationally standardized so that patients can receive the same level of care no matter where they reside. Dental anxiety continues to be a significant barrier that ultimately can prevent patients from seeking necessary oral health care. Previous negative dental experiences, fear of the unknown, and distrust can cause this vicious cycle of fear to continuously affect a patient's view of dental health care. This not only has a negative impact on the patient's oral health, but also contributes to overall systemic health issues. When patients avoid going to the dentist, they are more susceptible to tooth decay and periodontal disease. Poor oral health has also been linked to systemic body conditions such as diabetes, heart disease, and even some cancers. Dental assistants are in a unique yet underestimated position to help address this problem since they typically spend more time with patients during restorative procedures than the dentist does. This allows them to identify signs of anxiety before the procedure begins, build trust, and use patient management techniques that can help reduce anxiety levels and create a relaxing environment. By building a positive patient experience, patients will be more likely to return for future preventative care and treatment, which will improve their oral health outcomes. To ensure that dental assistants are qualified to manage patient anxiety, educational standards and training need to be considered. As of now, each state board of dentistry sets the standards for their own state's educational requirements. States like Pennsylvania have no requirements for dental assistant education, which can negatively impact the patient experience. Establishing national standards through the Dental Assisting National Board is a great way to ensure that dental assistants are properly trained to enhance patient experience. Once national standards are established, patient management techniques can be implemented into educational programs across the nation, which will lead to a more consistent experience for patients. Scholarships from dental insurance companies, dental offices, and other donors can be offered to students to make these educational requirements more attainable. Yearly training in dental offices is also important. Dental offices are already required to conduct yearly OSHA and HIPAA training, so adding patient management techniques would be beneficial to incorporate since it would help keep the office updated on the latest techniques that can reduce patient anxiety. Overall, patients want to feel welcome and safe in the dental office. When trustworthy relationships are built between the dental assistant and patient, patients can feel comfortable enough to return to the dental office for future care. By empowering dental assistants to receive the proper training, they can better address patient anxiety and enhance the patient experience. This will lead patients to improved oral health care, as well as improved overall health. Dental assistants truly are at the heart of change that is needed to positively impact patients' lives. Thank you for listening, and I appreciate the opportunity to share the findings of my capstone project.